Hi, everybody. I'm very excited to not see you, but at least know that there is a lot of people present and a lot of you come from my Super Parenting 101 class. Welcome. I will continue to be here and provide all kind of support to you as we go because we're finishing up our Super Parenting 101 live class. And although we're going to be moving to the asynchronous course, um, people who are taking the class or ever took the class can continue to get live support from me through these recurrent YouTube lives and those who taking super parenting course and my clinicians who I train receive my newsletter that are announcing these kind of live events when I do live Q&A. And if any of you who are not there yet want to receive my newsletter, please go on my website, childdbt.com, and you can be part of that and receive monthly, updates on DBTC and super parenting, including my YouTube videos and including when I'm holding these live Q&As. Let's start.
All right, so we've already got some questions coming in. The first question is social anxiety a typical problem for a supersensor? How can
Hmm.
you help a supersensor to cope or deal with social anxiety?
So, yes, there is a very high comorbidity with social anxiety for supersensors, specifically for supersensors who have emotional dysregulation. Now, not all supersensors will become emotionally dysregulated. However, emotional dysregulation means clinical level of vulnerability in our three core senses: self-love, safety, and belonging. So self-love is kind of like being good enough to love myself. And we start to create all kind of criteria, all kind of conditions to be able to achieve that good enoughness in order for us to love ourselves, which is insane by definition because self-love is unconditional and we're trying to satisfy conditions to achieve something that's unconditional, creating more and more vulnerability in our sense of self-love. Sense of safety. Where does the sense of safety come from? Ability to control. What can we control in that life to any degree? We can control other people. We can control life, circumstances. The only thing that we can possibly control to any degree, and that's not even a control, it's what we call ability to directly influence, is me, what I do, what I feel, what I think in my biology. And when I cannot control the only thing that I possibly can me, because as a super sensor, things happen and doesn't have to be much for me to have this huge emotional tsunami as the reaction. Therefore, especially when I'm emotionally dysregulated, that means that the next moment, I don't know what's going to happen. Am I going to face that challenge, run away from that challenge, freak out? I don't know. I can't control myself and I can't predict. The only thing that I can predict to any degree what I am going to do. And of course, our sense of safety goes out of the window. Plus vulnerability in the sense of belonging. If I don't feel comfortable with my own, with myself, if I don't feel comfortable in my own skin, if I don't give to myself what I need, what kind of relationships can I give, develop and maintain with other people? Because healthy relationship with other people stem from my ability to give. But for that, I first need to give to myself to be able to give to others. What can I give to me? Self-validation, self-reinforcement, self-control, cognitive self-restructuring, self-love, self-compassion, self-care. These are all the ingredients of what we call baking my own bread, satisfying my own needs. Now, with that foundation in mind, let me answer your question. Supersensors, specifically when they develop emotional dysregulation, they will indeed have a severe problem with their sense of safety because they cannot control the only thing they possibly can themselves. They have difficulty with the internal locus of control. What happens out of that They start to get the semblance of control somewhere and then start to create the illusion of control that can help them short term, whole disaster long term. How can we control other people or ourselves, right? Trying to control others or trying to control me. And what they do, a lot of the time, they are preferring, like all of us, to control others instead. Don't say that. Don't stand there. If you only gave me what I want, I would not have had this kind of a reaction, making them responsible for our own thoughts, feelings, and behaviors, which is insane. Other people are not responsible for that. Everything is neutral. Events are neutral subjectively. We make an interpretation of that event, and then we provoke ourselves with our own interpretation. We're not responsible for other people's reactions. They're not responsible for ours. However, when we are anxious, when we have, clinical level vulnerability in our sense of safety, of course, we will try to get the semblance of control, either by controlling other people, force, screaming, yelling, right? Physical abuse, damaging things, throwing things, or try to control ourselves. And that also is subdivided into two: effective, functional control, and dysfunctional control. Functional control, we just talked about: self control, self reinforcement, self validation, self love, cognitive self restructuring, self care, self compassion. Destructive is self punishment, self criticism, self judgment, using alcohol, using drugs, right? So, this is one way in which people try to decrease vulnerability on their sense of safety. This is using force against other people or against yourself to get the illusion of control. And avoidance, running away, trying to pretend it didn't happen, suppressing. And because we can't avoid, suppress all the time, that becomes a pendulum. It goes from aggressing towards others, suppressing, avoiding, aggressing towards others, suppressing, avoiding. And you can see with people who have anxiety disorders, this is the pattern that you see all the time, right? And the main way of dealing with that is to get and put the finger where it belongs, controlling the only thing you can, you, developing internal locus of control. So when your supersensors are learning and practicing skills of self-control, that taps into interventions on two levels: level of the symptom, instead of screaming and yelling, breathe in and out. That's level of the symptom. Screaming and yelling is not a problem in itself. It's a solution to a problem. Problems come from my relationship with me, sense of safety, self-love, and belonging, and clinical level vulnerability there that gives rise to all of those symptoms, right? If I hate myself, I'm going to self-punish. If I can't control me, I'm going to try to control other people. If I don't feel even comfortable in my own skin, if I don't belong with myself and my family, I cannot belong effectively with other people, right? So when we are teaching and learning skills, we tackle both level of symptom. Instead of screaming and yelling, walk away, breathe, use ice, and go straight into addressing and targeting the level of the problem, because it's improving my self-control and therefore, indeed, in real, decreasing vulnerability in my sense of safety in a healthy way.
Right. Another question, and just a friendly reminder, if you have any questions, please put them into the chat so we can ask them live. The next question is, some years ago, I discovered that my daughter is considered a highly sensitive child. Is that the same as a supersensor?
Well, let's talk about definitions, because using words, right, language is a very crude tool to communicate, because when we say a word, we are talking to another person using that word with the assumption that that person has exactly the same definition that we have, right? For example, the word stupid. One person may think stupid is, I'm not good enough. Another person may say stupid as I am not safe because I'm making mistakes. Another person may say stupid is the definition and the meaning of I'm different from other people, and therefore people may not want to be with me or associate with me. So meanings may be different. So when we say vulnerable, I'm sorry, a sensitive child, for me to answer that question, I need to understand what you mean by that. Because sensitivity can also be sensory processing, physiological sensitivity to the light, to the sound, to the taste, to the touch, right? Or it could be psychological sensitivity, which means high level of reactivity to low threshold of stressors. Not much need to happen. Somebody did not look at me right. An internal process, a memory, an association, right, triggers this event. A lot of the time people don't understand where is it coming from, what just happened, why did you get upset? So it's indiscernible to the naked eye, so to speak, what the stressor was. And that little minute stressor can trigger an emotional tsunami of huge reaction, not just going from 0 to 50, going from 0 to 100, going very fast, like a split second. They're like Ferrari race cars. You step slightly on the pedal, out, and slow return to baseline. They don't start to regain their self-control very fast within minutes. It can take 10 minutes, 20 minutes, sometimes hours. Now, these are challenges of emotional sensitivity. Everything comes in twos, everything is dialectical, everything is complementary. So we talked about the challenges. What are the benefits? What are the amazing gifts of emotional sensitivity? Number one, these people are able to experience positive emotions on a higher level, not only negative. When they get happy, they get silly sometimes, right? Also, they are like human x-rays because they have this, emotional apparatus that they can experience their own emotions really well. They can really read other people's changes in the emotional balance very easily. Now, they may misinterpret what they're reading. That is true. However, they can see that the person inside, something changed, something shifted, kind of the climate of the room or the climate within the person much more readily than a person with average emotionality. That's kind of like making them human x-rays. Again, they may misinterpret it, but they can read it very easily. Plus, because they understand what pain is, what suffering is, they can, in those balance moments between the times when the prehistoric monkey come out to claim this control back, when they become emotionally intoxicated, in between those moments, they're so caring, so understanding, so loving, so compassionate. So, you know, indeed, they have so much empathy to other people. And also, emotional sensitivity is tied with and associated with enhanced creativity. These children are very creative because they can not only like creativity is not just like they draw and they dance and they write poetry, or they have like mathematical abilities, right? No, that is understandable. But what we mean by creative is they can think outside the box, right? What they come up with, people are like, what are you talking about? How did you get that? Where did the idea came from, right? Because they have higher highs and much lower lows. They can see and experience things that a person with average emotionality cannot. They have more information to synthesize. So all of those are wonderful, fantastic advantages of emotional sensitivity. And if your child fits this profile, and that also comes with extra things in the package, such as avoiding effort, such as having problem with delaying gratification, such as not liking any kind of change and transition, such as having difficulties with attention, having a lot of energy, hyperactive, impulsivity, problems with interpersonal relationships, also a lot of the time issues with hygiene. They don't like taking showers and you know um, brushing teeth. So this is a package, and when I start to talk about this package, Parents of children who are emotionally sensitive say yes, 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 for about like 80 or sometimes 100% of all of the things that I mentioned. So if your child fits that profile, chances are your child is emotionally sensitive, which does not necessarily mean that your child will become emotionally dysregulated. Emotional dysregulation is not something that we're born with. We can be born with a higher risk for emotional dysregulation because these children are not born resilient. Emotionally sensitive and resilient, they're two sides of the continuum, opposite, right? Resilient children like ducks in the water. Everything rolls down their feathers. Supersensors, as we call them, emotionally sensitive, forget duck, forget feathers. They're like rocks. They immediately drown, right? So but that is predisposition. This is high risk, and these children come in with more needs for the environment to, meet, right? And we are not born with instructions, and parents don't necessarily know how to address the needs of those sensitive children. And then this transaction starts to happen when a child with extra needs, because they're emotionally sensitive, they're highly reactive, they have emotional tsunamis, they have a different brain. They have a brain that is also associated with learning challenges. They have a different brain, right? What is a learning disability? It's a disability of the system to teach that different brain. But they are having learning differences a lot of the time. They also have ADHD, highly comorbid. They also have, a slowly maturing cortical region. An 18-year-old supersensor may have maturity, cortical maturity, of a 10-year-old. What is cortical maturity? Brain slowed down. Yes, adult brain is slower than that of a adolescent, and that's why we adults less reactive than adolescents. That's all it is. We're just slower, and that cortical maturity for supersensor takes longer time. They have a different brain, therefore they have a lot of different needs that the environment may not know how to address. And good enough parenting is not good enough for them. And those of you who have multiple children and have a super sensor and have other children who are more resilient, you may see that. That the other two absolutely fine. And this one is climbing walls. Why? Same parents, same environment, same upbringing, and this child is struggling. Because good enough parenting is not good enough for super sensors. And doing the same parenting to all of your children is not good parenting. These are three different individuals that require three different approaches. So when we have more needs and the environment doesn't know how to meet them, child impacts the environment, dysregulates the environment, more dysregulated environment disrupts and dysregulates the child even more, all the way to emotional dysregulation and psychopathology. And we can stop that. And we can indeed raise these children in the environment that they need to thrive. You just need to do something very simple. Become a super parent. Not easy, yes. But yes, we can. Yes, we can. You just need to learn how to become a super parent. We are not born with that knowledge, right? And then you'll be able to provide your child with an environment when they can be able to easily, more or less, handle the challenges of the emotional tsunamis and then benefit from all of those fantastic and wonderful gifts that emotional sensitivity presents with.
All right. The next question is my daughter is 11 and she's very self-conscious and she started complaining about anxiety. She refuses to talk to a psychologist. She's embarrassed. How can I help her at home?
Yes. What I do, I train parents to become therapists for their child, not therapists for children, their child. Okay. So you knowing what to do can be indeed sufficient without you getting your child into therapy. It would be easier if you get your child into therapy and then the therapist and you combine forces in which the therapist is teaching the child what to do, and then you are reinforcing it and practicing it and modeling this, right? And you're learning how to become this protector for your child that you need to become if you want your child to develop normally, regardless of whether or not your child is a supersensor or not. All children need their parents as protectors, and being a protector means what? I am in control of me. I know exactly what to do, the parenting. I have a capacity to do it. I am not afraid of my child, accommodation. And my child is not afraid of me because I'm harmful, invalidating, criticizing, judging, and using prolonged punishment. So all of that is being put in a system. You becoming a therapist for your child alone is possible. Absolutely. Right. It's just going to be more difficult. And hopefully, as you're doing this with your child, you just need to learn what to do. Right. Just you need to learn how to do this. And then you being, that therapist for your child, above and beyond being a protector, now you're learning to be a super parent, meaning that you're becoming, a therapist, which is above and beyond what we even ask of parents when we're asking them to assume that role as a protector. Your child will become less and less self-conscious, because self-consciousness means, to me, the hypothesis that I'm gaining is that your child may have vulnerability in their sense of self-love, that they are self-critical, that they are self-deprecating, that they may have issues with self-esteem, and they created all kind of conditions of good enoughness that they're trying to satisfy in order for them to be at peace with themselves and love themselves just because they exist as entities, right? But they don't understand any of that. Most of us don't know about any of that. Most of us don't understand that we are neither good nor bad, that we're entities like sun, earth, moon, right? I am an entity, you're an entity. When a child is born, is the child good or bad? No, it's a child, it's a human being. It's a entity called human beings. Like sun is an entity of stars and earth is an entity of planets. Is sun bad because it burned my skin? Is sun good because it gives me light? No. Sun is sun, and that's the synthesis, two sides. Sun can burn my skin or give me light, right? The same as me, human being. I just am neither good nor bad, an entity. And I can do things that can be helpful, not helpful, useful, not useful. People like me, people don't, right? The ups and downs in life. What we do, the information field in which we exist, programs us to be one-sided. When my relationship with me moves from the unconditional side of the existence to conditional, and everything is merged in one. I gain, I'm good. I lose, I am bad. People like me, I am good. People don't, I am bad. All day long. What happens with that? Suffering. Suffering. Again, we're trying to achieve something that's unconditional self-love with trying to satisfy conditions. It's not going to happen. It's impossible. It's insane. And of course, anxiety is going to come out of this, right? So instead of understanding that I just am, I can always be at peace with me at all times. At peace means neither good nor bad. If I say I'm good, I can also be bad. No, peace is achieved. I'm neither. And I can succeed, fail. People like me, people don't, right? Instead of understanding that and learning how to maintain that side as stable, treating yourself as entity, people do what? Start to artificially constrict the fluctuations of life so they don't have to go on this roller coaster. Good, bad, good, bad, good, bad. How? Avoidance or force? And force. Avoidance, I don't want to see it. I don't want to go. I don't want to go to a psychologist even to help me fix my problems, right? I don't want to see my problems. I don't want to recognize my problems. Or, and force, trying to make other people do this, whatever I want, making them responsible for my reactions and for my thoughts and feelings, or trying to force, put force against me, suicidality, self-harm, drug, alcohol use, self-punishment. So your daughter needs to understand all of this. And you need to first learn all of this yourself and be able to apply it to you to be able to successfully help your child with all of this. And once she starts to develop this and learn how to indeed connect to her self-love instead of trying to achieve it. Self-love is unconditional. You can achieve some self-love. It's a gift. It's an instinct of self-preservation. You need to learn how to connect to it. And once you learn how to do it and teach to your child, by the way, it's very simple, not easy, simple. That's a dialectic. Everything that we're talking about is simple, not easy. Then sooner or later, she'll become less here, more able to let go and not just continue to avoid or force. Not just trying to avoid or force. Then slowly but surely, she may indeed warm up to seeing a psychologist, and because right now she cannot be that vulnerable. That's why she's avoiding. But if she's allowing you to do that with her, that would be fantastic and wonderful. But first, you need to learn it yourself.
Right. Just a reminder, there's some new people that joined. If you have any questions, please put them in the chat. The next question is when school is a trigger for vulnerability and core senses, triggering, I'm stupid, nobody likes me, etc. Does it make sense to stay in this environment every day?
We can stop external influences. There's just no way. Going away from the environments that are normative but causing us, anxiety and stress is just an example of avoidance. Of course, we don't want to be in the environments that are abusive or neglectful. That's different. But if it's a normative environment, then running away from it is not going to help anything. It may give you a relief temporarily, short term, but it's not solving the problem. And it's actually damaging the sense of safety even further. Because what we need to do, we need to give the child, right, instill in your child this, sense of self love, safety, and belonging. And by doing that, you are creating a force field around your child and also yourself once you learn that against the influences from the external environment. These programs from the information field, these influences, these stressors will not be as impactful to your child. And it's not about running away from difficulty. It's about learning how to solve them. And we need to do that. This is called pain. Pain of life is inevitable. It's part of life. We cannot run away from it. And as soon as we start to run away from pain, this is called pain plus not acceptance of pain. And that is an equation of what is suffering. Suffering is pain plus not acceptance of pain. And if we run away from normative, right, regular challenges, we're only going to run straight into the suffering because the child is not learning how to handle it. This is just avoidance, right? So we need to help the child to learn how to do this instead of running away from it. And we need that pain. It's a normative, absolutely unavoidable part of life. You can't run away from it. And we experience it as painful because it brings uncertainty. We don't know what's going to happen. We will be able to solve the problem, not solve the problem, right? We can't control life. We can't control circumstances. We can do our best and still not get the result that we want, right? And that's experienced as painful because at that moment, all of our core senses are going through this door of pain, right? Self-love. Oh, what if I will not satisfy my conditions for being good enough? Safety. Oh, what if I make a mistake? Belonging. Oh, what if people think that I'm this schmuck and nobody will want to be with me, right? That's door of pain. But if we refuse to get through this, we're going straight into the another door, suffering. And it's you open this door, this room is pretty much shallow. Immediately There's this wall that we're just going to bang our head on. And the only thing that's going to happen is a big bruise on our forehead. No, face pain, because through that pain and only through facing challenges, we can learn, we can achieve new mastery. When you're laying somewhere on the beach drinking pina colada, hopefully non-virgin, it's fantastic. It's wonderful. You're balancing out your hectic life, the dialectic, right? You need that. But are you learning anything new? No. You only learn something new through facing a challenge. So teach your child how to solve problems, give your child, instill in your child these three core senses, and then the child will be able to navigate life in an adaptive manner. Don't help your child run away and avoid, because you're only getting your child into the door of suffering.
Okay. Do some kids really need medication, especially with reoccurring unsafe behaviors at school?
Um, Knowing what to do is necessary but not sufficient. You also need to gain a capacity to do it. Capacity to do it consists of multiple different uh, aspects that need to be there. Capacity comes from my ability to put the finger where it belongs, me, internal locus of control. Nobody is responsible for the way I feel, think, and do things. I am responsible for it, right? All events can be objectively and are objectively both positive and negative. Everything has two sides, right? Positive and negative. War. War is a terrible, terrible event. People are dying, destruction, misery, pain, suffering. On one hand. On the other hand, all the advance of technology that we're enjoying right now came from warfare. That's the only reason why people started to develop all that technology. Without that, we still would be somewhere in the Stone Age, sides to everything. This is what objectively new, objectively good and bad, positive and negative, subjectively neutral. Whatever I make out of it, that's what I am going to interpret, right? And then I provoke myself with my own interpretation. I need to understand that, yes, other people should not, try to be abusive to me and really need to work on their own behavior and not try to be mean or whatever. Absolutely. And that's the paradox, because everything has two sides. And at the same time, they're not responsible for my reactions, just like I'm not responsible for their reactions, even though I need to really try to be as nice and, compassionate and positive, right, in my way of dealing with other people, as giving as I can. Now, so internal locus of control is number one. Um, Also, what we talk about, all other aspects of how to enhance this capability, such as practice, 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 practice. If I try to learn how to swim from watching a YouTube video on how to swim, I can be very knowledgeable about how all of those different styles of swimming are called, like how's this one called, this one called, this one called. But if I get to the pool, will that give me a capacity to swim? No. Therefore, I need to practice, 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 practice. So practicing skills with our children is one of the ways to get this, one of the first law of dialectic, quantity into quality, quantity, 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 practice, practice, practice. At some point, your child is actually going to be able to use a skill, right? That's another thing that goes into the capacity. However, some children also will require medication, because when we think about psychiatric conditions or emotional dysregulation, whatever it may be, again, everything comes in twos. There are at least two factors that feed into that: biology and psychology. Some people, 50% biology, 50 psychology, that feeds into that. Some people, 75 biology, 25 psychology, or the other way around. So the more biology is there, the higher the chance that we will need to use the medication to give this child a chance to actually use those skills, to be able to withstand the challenge of those emotional tsunamis and actually have a chance to use that skill in the moment without going all the way to emotional intoxication. So yes, then we will consider giving the child the medication, but we can't relax into that because as soon as you give your child medication, you're working even stronger, even more, right? Because now you have more of a room for change because the child is less reactive. And then we practice, giving them emotion regulation muscles, mindfulness muscles, the stress tolerance muscles, cognitive restructuring muscles, the relationship with themselves muscles, in which I just am an entity, neither good nor bad, and I can succeed, fail. All of that coming in, baking your own bread, so that we can titrate this child out of using this med as soon as possible, because medication is just a crutch. Specifically, psychiatric medications, they don't treat anything. They are crutches for the brain. And when that medication is taken out of the system, it actually can get much worse, as you all know, right? Why? Because our brain, just like any other part of our body, is very lazy, right? If you put your hand in a cast and you don't exercise muscles, what's going to happen when you remove the cast? Your muscles are very weak. Immediately, the body relaxes into cast being that support. The same is here with the brain. You give the medication and the body is relaxing, the brain is relaxing into medication doing the work. And then medication is removed and it'll be like, well, I forgot how to release that neurotransmitter. I don't know what to do here. And it takes time for that to gain this capacity back. So psychiatric medications don't treat anything except for, I think, the one that I know that actually has a lasting effect is lithium, right? All the other meds, just crutches. So why would we want for that to be there? It's not treating anything, right? And God knows what it's doing to the developing brain. What we don't know what it's doing to the brain of anybody, but for the developing brain. So as soon as we can get the kid out of the med, the better. Therefore, if there is a lot of biological component and the child is having difficulty with using all of those techniques because it's just too much reactivity, then of course consider the medication. But don't relax into that. Once you have a little bit more of a room, a bit of a more neural plasticity in there, practice. Get this medication out of your child's system as soon as possible.
Would you ever start DBTC with one child and not the sibling? Would that be problematic?
DBTC is started with one parent. I need one parent who is willing and who is knowledgeable, who is informed what they're getting themselves into and willing to do that. If we can have one parent who can learn to be this super parent, who will learn to be that protector for the child, fantastic, wonderful. We can go very far with that. Two parents who are willing and knowledgeable and work in unison and actually consistent between themselves is a luxury. A child on top of it who is willing, luxury upon luxury. I don't even need to have a child in treatment. I don't. Parents, you are primary. Your child is embedded. You are foundational programmers. You are unquestionable authority. You are the queens and kings of the household. Have all what you need to program your child in the way that you want them to be programmed. Your child is your product biologically and environmentally, which is a statement of hope. If the way that your child got programmed through this transaction, right? We come into this world prepackaged with hardware, our predisposition to psychological disorders, physiological disorders, our talents, our learning differences, all in there. And when this hardware starts to transact with the external environment, learning is starting to happen, software. So this is what you're responsible for. And by the way, it's your hardware too, and your software. So you're the main programmer. And you can program your child any way you want. So your child is your product biologically and environmentally. And that's not a statement of blame either. You did if your child is suffering right now and is having emotional dysregulation, you cannot blame yourself for that, because the blame can only be assigned if you knew what to do, had the capacity to do it, and decided not to. Then we can talk about blame. Did you know what to do instead? Have you been born a super parent? Can you feel ashamed of not being born a Superman or a Superwoman? Did you were you born with a star in your forehead and a cape? Feel ashamed that you were not born with a cape. No, you can't. The same as here. We're not born super parents. You need to learn how to do this. So, and this is the paradox. You're not to blame, and you are responsible, and you have all the tools. Again, you're the foundational programmers, you're questionable authority, your child fully depends on you. You just need to learn what to do. So you are primary. Child is not even needed in this. It's going to be faster and easier if child is participating to any degree possible. Even if the child comes to a session and says, I don't know, I don't care. That's okay. I can blab for hours, for example, and all I need is the child to actually maybe listen to what I'm saying. Doesn't matter. Sibling, of course, is important, 100%. And we do have sessions with siblings to help them understand what's going on, to help them ignore the child that is like the identified client, so to speak, right? To help them walk away, to help them not to, provoke, to have their own skills to withstand, right? So we want the entire family to be on the same page and as consistent as possible, right? However, sibling is not the main point. It's just one of the things, that we need to consider and deal with. So child coming in with or without the sibling, or even coming in at all, is not critical. Parent knowing what to do, being willing to do it. That's what we need.
Echoing the previous question, a child who is 9 years old and very intelligent but has a problem keeping up with school writing and math requirements. Should this child be left in a regular school?
I cannot answer that question. Do your child have learning differences? And again, when we talk about learning disability, it's a disability of our educational system to teach a brain that's not average. Supersensors don't have average brains. They just don't. And a lot of them not average to the degree that it can be translated and them and come out as a learning disability. So what we need is people who know what they're doing, teachers, educators who know how to teach the brain that's not average. That's all. And we all know that children start to thrive. Like, for example, I have a learning difference myself, right? And I know exactly what that means, and I know exactly what it looks like. And back then, when I was young with this learning difference, I was living in Ukraine 25 billion years ago. At that time in Ukraine, nobody knew learning differences, right? Nobody were assessing that or had any remedy for that, or any, personnel that could actually teach my brain, how my brain learns. And therefore, I thought that I was stupid. Yeah, that's pretty much. My self-esteem was down, and I'm a supersensor too. Not a good combination. So I kind of had to educate myself how my brain learns. But if you have a child who has a learning difference, then absolutely find them a person who knows how to educate that brain. Give them the tools, because it's not about what and how. Everything has two sides. Learning difference is very hard, specifically in regular education, and has tremendous potential for your child to be able to think outside the box. My learning difference gave me exactly that. I think outside the box all the time because my brain is different. That's why I got where I am. So two sides. So give your child a person who will know how to educate and who will give your child the tools so to know what you have and how to deal with it to the most effective capacity. And if you have somebody who can help your child with that journey, absolutely. Why not? Why would you want to keep your child in regular ed?
Right. When someone has a vulnerability in self-love with self-sabotaging behavior, is the only way to help to connect with self-love? Are there other strategies if you can't easily connect?
Well, um, the discussion of self-love is very complex. The strategy itself is very simple, but for that to be used effectively, you need to know a lot of information. So, as we always say, simple, not easy. There are many ways in which we can understand what's involved. The way to connect to it is the one that at least I know. There may be other ones, but I may not know them. So if you ask me, in my opinion, in my knowledge, in my expertise, what is the way to connect to self-love? Again, self-love and the sense of self-love are not the same things. Self-love is an instinct of self-preservation. You're born with it. Sense of self-love is an ability to connect to it at will, as you are, without trying to satisfy any of those insane conditions, trying to connect to self-love, which is unconditional by satisfying condition, right? The way that I know, the way that I teach, right? That's the one that I can offer. Maybe there are other ones. I don't know about them, but I do know one, and it works. It works to the degree that people who come to me who are suicidal and self-harming, in my niche is suicidology, meaning that I work with people who hate themselves so much that their instinct of self-preservation crumbled and they try to kill themselves. And even such a person with such self-hate with work can connect. And I didn't have one suicidal client that didn't end up connecting to self-love. Yes, of course. So I don't know if there are more than one way, but we do know a way at least.
All right, we just have a couple minutes left, so this might be the last question. But if a parent is also a super sensor and finds it challenging to remain calm when the child is angry, what advice do you have for that parent?
Well, number one, learn all of the skills. You first need to, again, me. So for you to be this protector, you first need to learn self-control. And of course, it's very challenging. And you're a super sensor yourself. And you are in the presence of a child who emotionally dysregulated. Listen, there's new research coming out. For example, the researchers came out of the Norwegian lab. These were actually the first therapists that I ever trained in DBT for children in like 2016. So they're coming up with all kind of new exciting research on DBTC per se, and also on a disruptive mood dysregulation disorder that supersensors are usually diagnosed with. And what they find out is something incredible, but totally understandable. What they found out was this, that they compared parental stress of parents who have children with disruptive mood dysregulation disorders, our supersensors, with parents, with the level of parental stress of parents of children with other psychiatric disorders, like severe, a major depressive disorder, anxiety disorders, Tourette's, ADHD, incompresses, all of these very, very severe disorders. And what they found that the level of stress for parents of children with DMDD, disruptive mood dysregulation disorder, is statistically much higher. And we can understand why. Because other psychiatric disorders are inevitable pain. It's consistent, it's predictable. These children don't come out of their major depressive disorder once a day and say, I'm so fine right now, right? It's all the time predictable, consistent. It's inevitable pain. Our super sensors, they're Jekyll and Hyde. This beautiful, wonderful, caring, funny, smart, compassionate, person that was just, having fun with. The next second turns in this prehistoric monkey comes out. What just happened? Out of the blue, seemingly. So this unpredictability, this coming out and being not just okay, not just average norm. No, exciting, funny, smart, compassionate, awesome. And then going into the depth of, mimicking, almost mimicking being antisocial, right? A lot of the time, those parents are asking me, am I raising a psychopath? Because my child is so cruel in those moments. No, they're mimicking the behaviors of they are indeed antisocial, right? Because in those moments they're emotionally intoxicated. So going this back and forth between total, right, with fantastic and wonderful and the unpredictability of this up and down, this is unpredictable and very high level of vacillation back and forth. That's what creates such an level of stress. And of course, when something is unpredictable, your own sense of safety is threatened because you can be in control of the situation because you don't know what's going to happen, right? And therefore, a sense of safety is associated with fear and anger. That's why parents of children with DMDD have such high levels of anger. They're constantly waiting for the other shoe to drop, so to speak, right? Of course, being afraid for their children and of their children. That's why there's such an enormous amount of also accommodation, right? And also, those parents tend to vacillate between accommodating. So just whatever. I can't take it anymore, like whatever, right? So that to prevent outburst. But at some point they need to get the control back and they're vacillating all the way to force, screaming, yelling, prolonged punishment, harmful invalidation, whatever, back and forth, back and forth, back and forth, right? So we need to understand all of this. We need to learn how to deal with that. And we need to first, of course, have our own ability to control ourselves and understand what's going on. And my advice for now, my little 2 cents that you can use right now, at the moment of emotional dysregulation, your child is emotionally intoxicated. They're drunk for all intended purposes. Okay. And what kicks in is biology. If you had a child who had Tourette's, who will be saying, da, 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 all of that, would you be as angry? Probably not, because it's biology, you understand. With this child, in this particular moment, that's exactly what's happening. They're just as capable of controlling themselves in this moment as a person with Tourette's. Now, they have much better prognosis than a person with Tourette's because a person with Tourette's is a biological disorder. They cannot treat it with psychological means. Emotional dysregulation can't be treated with psychological means. They learn techniques, they learn, all of these skills, they get all those muscles to withstand the pressure of the emotional tsunamis. And at some point, they're going to get into this situation when they can control themselves better, right? Plus, the maturation of their brain is going to kick in. This 12-year-old at the point of dysregulation is a 2-year-old with Tourette's. So when your child 8, 12, 18 having this kind of an outburst, change the way you think. Remind yourself, right now, my child is functioning on a level with 2-year-old with Tourette's. Would you be as angry or not? Probably not. And this is the whole point of this. You change the way you think, you change its products. Our feelings and our actions are products of thoughts. If you change the way you think, you change the products. We all know that. Colloquially, it's called, I just changed my mind. So one of the main tools, of course, your own skills training, of course, baking your own bread, self-validation, self-reinforcement, self-control, self-love. All that is very important. And cognitive self-restructuring. If you change the way you think, you will change your capacity to withstand the pressure.
All right.
All
So
right. Those of you who are indeed in my newsletter, I will let you know when the next one is coming. Otherwise, I will see you next time.